This is a survey in Asia, and this is a survey showing na nagkadaghan gyud ang osteoporosis. So our bones, our bone density as we grow old because of less exercise or less activity, less muscle mass, and even less hormones, we can have osteoporosis and we can have what is called sarcopenia, kanang magkagamay ang muscle density. And it can be because of menopause that testosterone levels grow smaller. And this is a graph showing the projection of people aged over 60 in the Philippines at 2050. So nakadaghan gyud ang mga elderly nato. They call it the silver-haired tsunami kay nakadaghan ang mga silver-haired people. And with this will come the high probability of more fractures occurring. So we don't want to have any fractures in the future, and we can prevent this even now by a good diet, good exercise, taking care of our eyesight, and we can hopefully lessen this projection in time. But with increasing aging population, I want to talk about hip fractures because it is one of the most expensive to treat. Ma-aksidente gani or mabalian og bukog mahal gid kay na, and mortality kanang dili magpa-opera for hip fractures because this is actually considered an emergency in different parts of the world. Diri lang sa Pilipinas na agiun pa ang pasyente og hilot og mag self-medicate pa, and then maybe after a few weeks diha pa siya mo show up sa clinic or sa hospital. And I want to say that there have been studies here in our country that mortality rate is 50% at 1 year. So because kaning mga pasyente nato dili na sila makalihok, magkaluya sila, they can have complications, kanang komplikasyon sama ng pulmonya, ubo-ubo, di sila kalibang mag-pressure sore kay magsigil lang o higda, so masamad ang libot, masamad ang likod, daghan pwede mahitabuan ni nila. So mobility is an important factor for survival. Ganahan ta na makalihok niyang atong mga pasyente para dili magkaluya. And this is an average estimate in the Philippines. Of course, makakita gid ka na naay possibility na nabali ang bukog kay mumubo ang kanang tiil o nagtuyok siya. So shortened and externally rotated ang ato makit-an bisag sa emergency room pa lang makaklaro na miani. X-rays will also confirm this. So these are X-rays of a hip fracture, and this is treated in the Philippines just 50% surgically. Most of the countries, especially first world countries, will treat this right away within 3 days kay emergency like any. There are types of surgeries na we repair using screws or plates, but we have to also know that not all surgeries for this, especially fixation surgeries, are successful. Bone does not always heal, and internal fixation, kanang plates and screws, can have complications, which is why a lot of the surgeons will avoid plates and screws and go for a hip replacement and treating the osteoporosis. So replacing the bone, kay kabuk naman, that is a way to deal with the osteoporosis and the hip fracture at the same time. But remember, we also need to treat the osteoporosis by medication, proper diet, and exercise before we go into total hip or partial hip replacement.